Hi Hannah.
Hello.
Very nice to meet you. So, why are you here today? Do you have any medical problems?
Yeah, I've been having some pain in my left side stomach area.
Okay. So, and can you tell me, was it sharp or dull?
It feels like sharp, but it comes and goes.
Okay. And like where or when do you get it?
It's usually during the day, like if I'm sitting for a long time or just even when I'm exercising too, I can feel it.
Okay. And is it related to food?
Doesn't seem to be.
Okay. So there is no intolerance, right?
Not that I know of, no.
Okay, perfect. And does it bother you for a long time now?
For like a week.
Okay.
Yeah. A couple weeks maybe.
Couple weeks, okay. Perfect. So it actually could be like a pretty serious, or it wouldn't have to be so serious. We'll have to check it out, so I will have to do an abdominal examinations later, if that's all right.
Yeah, that's fine.
Yeah. Okay, I'm just going to write the notes down. Okay, so can you tell me where are we at this moment?
We're at the doctor's office.
Yeah. And could you tell me what date it is?
It is Friday.
Yeah. Perfect. So it seems that you are mentally alert, you're in no immediate distress. I will just look at your features and symmetry and look for anything abnormal, okay? Okay, so your skin seems actually to be really nice. There are no lesions, no acne, no bumps, lumps, anything that I'm aware of. I will look at your hands as well, if you do not mind. I will take your hand and look at it, look at the skin. Okay, so there are some couple of moles, but that's normal. Doesn't seem to be anything really troublesome. Okay, now your fingers and fingernails. I can see that you have here a cut. Did you cut yourself?
Yeah, just a paper cut.
Yeah.
Recently.
Okay, and did you disinfect it?
I did. I washed my hands.
Okay, perfect. Now your other hand. Okay, so let's look at your skin here as well. Okay, now here. Okay, so the inner side seems good as well. Okay, I'm just going to try the temperature now to see if there is like good blood circulation. Okay, it seems that your hands are actually pretty well, pretty warm, and the distribution is good. Okay, do you feel like you are like in a great temperature now?
It's a little warm in here.
Yeah, a little warm in here, right? Yeah. Okay, perfect. Okay, that's perfect. So the color of your skin seems to be perfect for your ethnicity. I will try the Turkish test if you do not mind. It basically means that I will like pull your skin like that, and if it goes back really easily and fast, it means that you are well hydrated. Okay, so perfect. Now your other hand. Do you drink a lot of water?
I try to, yes.
Yeah, okay. How many liters per day? Or glasses?
At least 8 glasses.
8 glasses. And are they small or big?
Large glasses.
Yeah, large glasses. Perfect. Okay, do you exercise?
I do like 3 or 4 times a week at least.
Okay. And what kind of sports do you do?
I do a lot of biking,
Okay,
walking, and yoga.
Walking and yoga, okay. Do you have any allergies that I should be aware of?
Just seasonal.
Okay, seasonal allergies. Okay, perfect. So I'm just going to look at your scalp really quickly, and I will first palpate it. If there is like any kind of bump or lesion that should not be there, then I will look into the hair with the light. Okay?
Okay.
Perfect. So I'm also going to check the scalp for hair loss. Do you feel like you're losing your hair excessively?
No, I don't.
Okay. So this seems to be fine so far. Okay. That looks good. Now from the behind. Okay, now to the other side. Okay, that seems to be good. I'm also going to use the light and just look into your hair. I thought that I saw something suspicious right here, but it's okay. Yeah, it was just a bite from a mosquito. So I'm just going to palpate if there is anything we should be mindful of. Okay, seems fine. Did you have your eyes checked recently?
Not too recently, maybe a couple of years.
Okay, and do you wear glasses or have any trouble seeing?
No.
Okay, perfect. I'm just going to try it for myself, okay? I have here this chart, okay? And I will put it right there and I will show to a certain letter and you will tell me what it is, okay?
Okay.
So can you tell me what this is?
T.
Okay, this,
H.
this,
L.
this,
Z.
and this.
T.
Okay,
H.
yeah, and this.
B.
Yeah, okay, perfect. So it seems your eyesight is pretty good. I'm going to take some colors now and you will tell me what color do you see, okay?
Okay.
So what's this color?
It's like a yellowish green.
Yeah,
Yellow.
perfect. I would say yellowish green in this particular
Pink.
lighting.
Pink purple.
Pink purple, right? Yes, this.
That's like an orange red.
Yeah, perfect. And could you tell me what this color is?
Blue.
Yeah, that's blue. Perfect. So now I'm just going to check your pupillary response, okay? Which means that I'm going to shine a really bright light into your eye and I will watch if the pupils constrict and dilate as they should, okay?
Okay.
So I will first try like direct. So I'm going to shine from here and then from the temporal side and I will check it from there, okay?
Okay.
So first here, I'm just going to make this. Okay. Now from here. 3. Again from here. Good. And from here. Great as well. Now from the temporal side. And from the temporal side. Now we will look at the corneal reflection. So I'm just going to go from the temporal side again and see. Okay, so it is intact bilaterally, which is perfect. So now, Hannah, I'm going to look at your eyes, okay? I'm going to get really close to you. So be aware of that. I will try not to make it uncomfortable. Also, I will be visualizing your optic cup and I will also be visualizing the borders and the vessels and see if there is anything irregular. I'm going to look at the sclera and its color as well, okay?
Okay.
So I'm really going to get close to you. I'm just going to really, yeah, adjust it and look at the optic cup and it's pretty normal. The vessels are nice, perfect. Yeah, that's great. Now the other eye. So the borders are pretty clear. The borders are pretty clear. Your pupils are normal as well. I do not see any problem. I do not see any crescent shadow as well. And no nystagmus. That's good. So that seems that your eyes are pretty fine. We are now going to try some hearing tests. So I'm going to take the tuning fork, I'm going to ring it and put it in the middle of your head. right there in the middle of your forehead. And you will tell me where you feel the distribution, and then I will put it like behind your ear, like so. And you will tell me when you stop hearing it, okay?
Okay.
Okay, so can you feel it?
Mm-hmm.
And do you feel it more on the right or left side?
It's about the same.
Yeah, about the same. Okay, perfect. I will put it behind your ear. Okay, tell me when you stop hearing it.
Stopped.
Okay, can you hear it now?
Mm-hmm.
Perfect. Now the other side. So I'm going to put it right here. Tell me when you stop hearing it.
No.
Okay, can you hear it now?
Mm-hmm.
Perfect. So do you find yourself having some troubles like actually hearing?
No. Not
Okay.
at all.
Yeah. Not even in a busy room?
No.
Okay.
Depends how busy.
Yeah. Of course, like if you're in a construction, it's pretty normal that you won't hear a thing basically, but if you're like in a normal busy restaurant, you should be able to hear the partner you are there with.
Yes.
Or friend. So I'm just going to now like shine the light into your ear, and I will look into it if there is any kind of obstacle, okay? So basically what I'm going to do, I'm going to pull your ear a little bit. This is going to be a little uncomfortable since I'm going to put it really into your ear a little, but not really too far, so don't worry, just don't move your head, please.
Okay.
Okay, so I'm just going to pull. Okay, so I'm looking in and it seems pretty fine. Okay, that's great. I can see the eardrum and the reflection, and it's pretty nice. There was no obstacle, no earwax. Okay, now the other side. Okay, so this looks about the same. That's perfect. Yep. Great. Okay, again, the light reflection is pretty fine. Okay. Now, let me just take a light. It is a light of color, and I'm actually going to be looking if it shows me anything abnormal on your face. Okay. And here. Perfect. Now I will take a different one. Okay, perfect. Everything seems to be fine. I'm just going to palpate your face now. I will be palpating your frontal sinuses, your maxillary sinuses, and then your lymph nodes, okay?
Okay.
Okay, so tell me if you feel any pain.
No pain.
Okay, now the maxillary sinuses. Okay, I'm going to be palpating your nose. Tell me if you feel any pain. And I will be moving the cartilage from side to side. It's pretty movable, perfect. Now I'm going to go to the lymph nodes. I'm looking for any glands. Okay, if there's anything uncomfortable, let me know. I'm just going to, palpate the supraclavicular nodes. Okay, now here. Perfect, great. So what I'm going to do now is that I'm actually going to listen to your heart. So first off, I'm going to ask you to breathe in and then breathe out and hold your breath, okay? It'll be just for a few seconds, so if you can bear it, I will put the stethoscope on your neck right there, okay? Exhale. Perfect. That's great. That's working as it should be. So now what we are going to do, I'm going to listen to your heart. So I'm going to just ask you to like put your shirt a little bit aside. It doesn't have to be necessarily a lot, and I need it only on the left side.
Okay.
Perfect. So I'm just going to listen. There are like 4 areas I'm going to listen to here. Okay, now here. And there as well. Okay, it seems to be pretty strong, so you can now put it back on. Okay, Hannah, so now that I've got you turned around, I will actually be palpating your back, so don't mind me touching me. And I also will be checking if there is any kind of skin problem on your back, and I'm going to be osculating to the lungs and look at the lung expansion. Okay, so first I'm going to look at the lung expansion, which means I'm going to put my hands on your waist basically like this, and you are going to exhale out first. Okay, and now inhale. Okay, perfect. And now exhale. Perfect. That's great. So the lung expansion is pretty normal. So what I'm going to do now is that I'm going to osculate at first. Okay. So I'll ask you to breathe a little more deep, but it doesn't have to be like super, super deep. Just a little more deep. I honestly do not hear any wheezing or whistling. Everything seems to be pretty good so far. Okay. Okay. That's good. Yep. Perfect. Yep. Great. So what I'm going to do now is that I'm going to be palpating your spine, and you tell me if you feel any kind of pain, and that I'm going to be palpating around the spine. Okay, so first I'm going to be doing the spine. Is there anything painful? Okay. Okay, now here, tell me if you feel anything painful. I'm just going to press onto some points.
No pain.
Okay. Is there any pain?
No.
And in the lower area? Do you sometimes struggle with backache?
Sometimes my lower back a little.
Yeah, okay. And is it on the same side as your, as like you having the abdominal pain?
I'm not sure. Maybe both sides.
Yeah, okay. I'm just going to palpate around the spine again, as I said before. Tell me if you feel any pain. I'm then going to be percussing, which means that I'm going to be like tapping on my fingers to see if there is like resonant or dull sound. Again, if you feel any pain during the procedure, let me know. Perfect. Okay. Do you feel any pain in the neck area?
No.
Okay, I don't feel that you would have tight muscles here. It's good. You probably do not do like manual work, do you?
No.
Yeah, okay. Do you sit behind a computer a lot?
I do, yeah.
Okay. Okay, perfect. Thank you. So now we'll like give you your shirt and you can put it back on. However, I would ask you to keep it open because I will do the abdominal examination.
Okay.
Okay?
Thank you.
Okay. Like this. Perfect. Okay. So now that I have you on the bed, I will palpate your abdomen. It will be really light at first, but first off I'm going to be osculating, which means I'm going to take a listen to the bowel movements.
Okay.
Do you have any troubles with your digestion?
No.
Okay. So I'm just going to listen. Okay. Okay, so I have a positive bowel movement in the second quadrant. I'm going to now listen to the abdominal artery. Okay, perfect. Yeah, great. I hear positive bowel movements in all four quadrants. Now from the side and from the other side. That's great. Perfect. So now if you do not mind me, I will start to palpate. First it will be really light, and if you feel any pain, let me know.
Okay.
Your organs can actually get really irritated if I press a little too much somewhere where it's unnecessary.
It's a little tender right there.
Yeah, okay. Around the hip area, right?
Mm-hmm.
Okay. Is it hurtful even there? Not really?
Not really, no, more
Yeah.
towards the hip.
Yeah,
more like
so
here.
more like here, right?
Mhm.
Okay. What about here?
No, it's fine.
Okay, here.
It's okay.
Okay. On the side.
Nothing.
And here.
Mm.
Just
Yeah,
a
more
little.
like there.
Yeah. Okay, perfect. I'm going to be like again percussing. I'm going to listen to the sound, okay? On the other side. It is normal that the sound actually changes in certain areas. Okay, right there. And here as well. And lastly here. Perfect. So now I'm going to go a little deeper in this area.
Okay.
It might be a little painful, a lot. So if there is like really sharp pain, let me know.
Okay. It's definitely more tender when you press harder.
Yeah.
It feels just like really tight.
And on a scale from 1 to 10,
Maybe like a 6.
6, okay.
Yeah, right in the hip feels really like tender.
Yeah. And you said that you sit a lot, right?
I do.
Yeah. It actually might be a thing that when people sit a lot, they get like tight psoas muscle. And it might be the problem, so it would be really good if you just start to stretch it out. Okay, and it would be good to visit a physiotherapist. They will give you some exercises to do, like daily. It really has to be daily. It doesn't take long. It takes about 10 minutes each day. It's better if you do it more often, of course. And the thing is, it's really good to like work for a while, for about an hour, where you sit, and then just have a walk for about 5 to 10 minutes, just to really stretch the muscles, okay, and change the positions. Okay, so I think this is it. I will have you sit down here on the bench again, and yeah, we can continue.
Okay, thank
Perfect. So Hannah, it seems that you are pretty much healthy, except the psoas. Everything seems to be intact and fine. So if you have any trouble in the future, definitely let me know. Call me, or even you can write the nurse, and we will have you scheduled in our schedule.
Okay, thank you.
Yeah.
Thank you, Dr. Kewa.
Yeah. Thank you. Have a wonderful day.
You too.
Bye.